Hello, this is a specimen of a uterus which has been partially bivalved longitudinally, and we have bilateral adnexal structures. We're looking at the anterior view, so this is the right fallopian tube with the fimbrial end here and the right ovary, and this is the left fallopian tube with the fimbrial end here and the left ovary. This is the posterior view, and we're looking at the posterior serosal surface of the uterus. And again here we have the left fallopian tube, the left ovary, and we have the right ovary here and a little bit of the right fallopian tube at the fimbrial end that is visible. Looking at this specimen, there are two major abnormalities that stand out. First of all, the uterus is large. It is enlarged if you look at the scale here, with this being the 7 centimeter mark, and the myometrium is also thickened. This could be attributed to a state of pregnancy, although this is an abnormal pregnancy. The other main pathology is seen with this very irregular mass in the endometrial cavity, and part of it also appears to be infiltrating into the wall of the uterus. This is an irregular mass which appears quite variegated. We can see these dark, almost blackish areas which represent areas of hemorrhage, and we can see these extremely pale areas which are likely to represent areas of necrosis. So we have an irregular, variegated appearing tumor sitting in the endometrial cavity, and this appears to invade also into the wall of the uterus. And this is an example of a gestational choriocarcinoma. A choriocarcinoma is a malignant neoplasm, and this arises from the trophoblastic cells. There are no chorionic villi in this tumor, so this is different from an invasive hydatidiform mole. This is purely composed of trophoblastic cells, meaning cytotrophoblast and syncytiotrophoblast. Because of this trophoblastic nature of the tumor, the cells often invade blood vessels, and this explains a very hemorrhagic appearance often. Even in the metastatic tumor, there is also often a lot of hemorrhage. And this tumor, because of its tendency to invade blood vessels, tends to metastasize widely. There are two main types of choriocarcinomas. There is the gestational choriocarcinoma, which usually arises, as you see here, in the uterine cavity, and the non-gestational choriocarcinoma, which is part of the spectrum of germ cell tumors and often arising in the ovary. So gestational choriocarcinomas are often associated with a pregnant state, and the pregnancy may be normal or abnormal. And what I mean by abnormal is, for example, ectopic pregnancy, molar pregnancy, or even a pregnancy associated with a spontaneous abortion. The prognosis for gestational choriocarcinoma is excellent. Even if there are widespread metastases at the time of diagnosis, these are very chemosensitive. The opposite is true for non-gestational choriocarcinomas. So these usually arise in the ovaries, and they are part of mixed germ cell tumors often. It's very rare, but it can occur as a pure choriocarcinoma, and the prognosis here is extremely poor as opposed to gestational choriocarcinoma. Clinically, the patients may present with pervaginal bleeding, and this can occur during pregnancy or up to several months after pregnancy. And also the patients may present with symptoms attributable to metastasis. One of the commonest sites of metastasis is actually in the vagina, which also explains pervaginal bleeding. And these can occur to distant sites, for example, the lungs, the brain, liver, kidneys, etc. And often these patients have abnormally high HCG levels. Let's take a quick look at the microscopic appearance. These microscopic pictures are taken from the Pathweb online resource, and we can see here that this is a low magnification view of the wall, the myometrium of the uterus, and this is towards the endometrial side. So there is this tumor here which appears quite bluish, and we can see that it is infiltrating into the myometrium. At high magnification, we can see very ugly appearing malignant cells with prominent nucleoli. This particular one shows a multinucleated appearance, so this is part of the syncytiotrophoblastic tissue. And over here, the cytotrophoblastic cells, they are often very large, have very pleomorphic nuclei, and this is a mitotic figure. So remember, this is a tumor composed of trophoblastic tissue, and we can see large areas of hemorrhage. And being trophoblastic tissue, these cells are immunohistochemically positive for HCG, or human chorionic gonadotropin. And this is the immunohistochemical stain that actually clinches the diagnosis. Hence, in summary, this is a specimen showing a large hemorrhagic and necrotic tumor in the endometrial cavity and invading into the myometrium. And this is an example of gestational choriocarcinoma. This tumor has a very good prognosis despite the presence of metastases, often at the time of clinical presentation. Thank you.